Alterations in musculoskeletal function. The picture on the left is the daughter of one of our former students here at Owens. And don't you wish you were still that flexible? On the right, you're going to see the axial skeleton. Fracture is a break in the continuity of the bone. Complete fracture means that it is broken all the way through. An incomplete fracture means it's damaged, yet it's still intact. It's not broken all the way through. An open or compound fracture means the skin is broken and you see the bone. A closed or simple fracture could be either a complete or an incomplete fracture. The comminuted fracture means you have two or more fragments. A linear fracture means the fracture is parallel to the long axis. A spiral fracture, an oblique fracture is at a 45-degree angle to the long axis, and a spiral fracture is one that goes encircles the bone. There's also a transverse fracture that goes straight across the bone. There is a table and pictures on page 1029. And this is another way that's looking at the different types of fractures that are out there. And it shows some of the different causes that go with it. And again, simple fracture, comminuted fracture, open fracture, different fracture types that there are. Fractures of the bones are classified in a number of ways. A simple fracture involves a single fracture through the bone. A comminuted fracture is one in which the bone has been fractured into two or more fragments. An open fracture is one in which the fractured bone penetrates the skin. And this is just a little close-to-home comic from 2001. The HMOs are really pressuring us to be more efficient. So if you've got a broken arm, you just stick it through and she will cast it. A pathologic fracture is a tumor, can be due to a tumor, osteoporosis, infection, or metabolic disorders. A stress fracture occurs with athletes or dancers. It can be due to fatigue or insufficiency. Pathologic fracture tends to mean that it occurs at the site of a pre-existing problem. It tends to occur more so with tumors, osteoporosis, infection, or metabolic disorders. A stress fracture occurs with athletes or dancers, and here it's normal or abnormal bone that's exposed to a repeated insult. Stress fracture can be due to fatigue, and this is because of repeated stress on normal bone, and it ends up that the muscle strength exceeds the bone growth. If you change your exercise program, this will occur if a fatigue or stress fracture. If changing your dance program or as an athlete. Insufficiency can also cause a stress fracture, and this is where you have an abnormal bone but normal activity that causes the fracture. This tends to occur mainly with osteoporosis, rheumatoid arthritis, radiation, osteomalacia, or hyperparathyroidism. A transchondral fracture is a fragmentation and separation of a portion of a bone at a joint. It usually occurs in the femur, the ankle, the kneecap, the elbow, or the wrist. An incomplete fracture, there are three types. Green stick is where the outer surface is disrupted, but the inner portion is okay. This tends to occur with children, in the tibia, the radius, and the ulna. A torus fracture is where the cortex buckles but does not break, and this tends to occur with osteoporosis. Bowing, there's a picture there at the bottom right. It shows bowing. It's the bending of the bone. A bowing fracture is very, very difficult to repair. And here's a picture of a green stick fracture where it's partially through. It's an incomplete fracture in a long bone of a child who's not finished growing. Fracture involving a growth plate, that's the cartilage plate near the end of the bones of a growing child where growth occurs, can lead to disturbances in the growth of the bone, even if it is treated properly. The pathophysiology of fractures. Initially, the blood vessels in the cortex, the marrow, and the soft tissues are disrupted. Bleeding occurs and a hematoma forms. Then bone tissue dies. The inflammatory response is initiated, and within 48 hours, the blood flow is increased. The healing process begins with bone-forming cells arriving, and then new bone is formed. There's no scar tissue formed, just new bone. Symptoms are initially a deformity, swelling, spasm, decreased sensation, tenderness, and pain. Numbness will occur for about 20 minutes after the injury, and then the pain is severe and incapacitating. Pathologic fractures will cause angular deformities, painless swelling, and generalized bone pain. A transchondral fracture is asymptomatic, or it may have pain only with movement. A crepitus is an audible clicking sound that occurs with movement. This is showing bone remodeling. In the remodeling process, bone sections are removed by bone-absorbing cells, or osteoclasts, and replaced with new ones laid down by osteoblasts. This will take about 4 to 5 months to be complete. Again, this is looking at your bone healing stages. Initially, that's a normal bone, and then the first one on the far left is a normal bone. The second is where you have a hematoma is formed with the granulation tissue. Hematoma here is spelled with H-A-E-M-A-T-O-M-A, so you know that this is taken from a British journal. The third one, the one in the middle, is where you have an acute inflammation of the injured area, the marrow cavity, and the surrounding soft tissues. Blood vessels from the periosteum invade where the normal blood supply has been interrupted, organizing it into a granulation tissue. Cellular proliferation begins throughout the affected bone area within 24 hours of injury. After a few days, it is confined to the fracture area, and you get a cartilaginous callus. The fourth picture shows bony callus and a cartilaginous remnants, and this is formation of your primary callus. During the first months after injury, a fibrocartilage callus is formed. The dead bone is resorbed and immature woven bone appears. The size of the callus is affected by the immobility of the fracture site. The smaller the amount of movement, the smaller the callus. Woven bone is gradually replaced by laminar bone, and the fracture is united by this bony secondary callus. And finally, we have remodeling at the end, and the final phase is remodeling, where the shape of the bone is gradually returned to normal, but that can take several years. Complications of your fractures. Now, this is not in your textbook, but you need to think about it. You may have impaired healing. This is due to malnutrition, comorbidity. It depends upon the nature of the injury, the extent of the injury, the adequacy of the treatment. It can cause either a delayed union or a non-union. Fracture blisters can occur. That's where the surface of the bone develops a bullae and blisters. This occurs mainly with increased risk with peripheral vascular disease, following a motor vehicle crash or accident, increased manipulation of the fractured bone. And the blister will occur because of edema formation. Compartment syndrome is when edema compresses the tissues around it, causing ischemia. This can occur more so in the leg and the arm. Symptoms are pain and paresthesias, which is numbness and tingling. Treatment is a fasciotomy, where they actually cut the muscle tissue along the sides to release that edema, because if they did not, it would cause necrosis of the tissue in that area. Fat embolism is a syndrome. Fat embolism syndrome is due to fracture of the long bones or bones of the pelvis, where a fat embolism is released within hours to 4 days after the injury, and can cause death, because it is a pulmonary embolism that's made of fat. This again is looking at complications following fractures. This is the one for compartment syndrome. For crush syndrome, you've got limb compression causing local pressure, local tamponade or pressure again in that area. Lots of edema. You'll have muscle and capillary necrosis that again leads to edema, rising in your compartment pressure, compartment tamponade, in other words, pressure pressing down on your arteries and your veins and your nerves in that area, causing muscle ischemia and neural injury. Can cause a contracture that's called Volkmann's contracture, can cause muscle infarction. That's a compartment syndrome. If it goes on to cause breakdown of your myoglobin that shows up in your blood, that's myoglobinemia or rhabdomyolysis. which is breakdown of skeletal muscle as a result. That will cause renal failure. The muscle infarction can cause your extracellular fluid shifts, can cause shock, leading to renal failure or cardiac arrhythmias. And the muscle infarction can cause acidosis and hyperkalemia, which can cause cardiac arrhythmias and lead to shock. That's the part that's called crush syndrome. And this is showing someone who has hip fracture, cannot move their leg, shows the risk factors on the left, shows the nursing priorities on the right, and the treatment up above. This again is another diagram looking at fractures, all kinds of fractures, the different types that they might have, the things that you look, your 5 Ps, your pain, pulse, pallor, paresthesia, and paralysis, the way in which it's treated, possible complications. It's a really busy slide, but it tells you just about everything you need to know about fractures. Dislocation and subluxation usually accompanies a fracture. Now, a dislocation is a temporary displacement of bones. In the Western movies with John Wayne, someone always falls off a horse and requires having their shoulder put back into alignment by having the Duke put his foot on the shoulder and pulling the affected arm with both hands. We've come a long way since the 1800s in the treatment of dislocations. We don't actually have to put our foot on your shoulder and pull any longer. Now, subluxation is a partial displacement. Dislocations, subluxations usually occur in people under the age of 20. If they have a congenital or acquired disorder of balance, joint instability, or incongruities in articulating surfaces of bones. In other words, they don't mesh appropriately. Usually accompanies a fracture. Symptoms are pain, swelling, decreased movement, and a joint deformity. It tends to occur mainly in your shoulder, your elbow, your wrist, your finger, your hip, and your knee. Both can cause a displacement of the two bones, the dislocation or the subluxation. And here we've got a normal hip on the far left, showing dysplasia, the next slide, then subluxation and dislocation. And you can see how the hip joint has been affected. If you have a support structure problem, you may have a sprain, and that's a ligament that tears and ruptures. Sprains tend to occur mainly in your wrist, your ankle, your elbow, and your knee. Or a strain, which is a tendon that tears. Strain has a T in it, so therefore that's the tendon. The sprain is a ligament. The strain, it tends to occur more in your hands, your feet, your knee, your upper arm, your ankle, and your heel. The pathophysiology is that an inflammatory exudate will develop between the torn ends. Then a granuloma will form from the surrounding soft tissue. Collagen formation begins after 4 to 5 days. It will interweave with existing tendon fibers parallel to the lines of stress, and eventually will separate from surrounding soft tissue. This takes 4 to 5 weeks before they have sufficient strength. Now, sometimes they will have an avulsion, and an avulsion is the complete separation of your tendons and ligaments from the bone. Symptoms of that are it's very painful, swollen, there are changes in the contour, and they'll have dislocations and subluxations of the bones. The pain is very sharp and localized. And this is showing the tendons connecting muscles to bone and ligaments connecting bone to bone. Tendinitis is inflammation of the tendon due to trauma, crystal deposits, or hypermotility. Epicondylitis is inflammation of the tendon where it attaches to the bone. Lateral epicondylitis is tennis elbow. Medial epicondylitis is golfer's elbow. Bursitis is inflammation of the bursa, which is the small fluid-filled sac which lubricates and cushions the joints and tendons. That pain, that inflammation is due to trauma. Symptoms are pain. It's localized to the site. That gets worse with movement. Also, you'll have the symptoms of inflammation and weakness. This tends to occur mainly in the shoulder, the hip, the knee, and the elbow. Myoglobinuria, or rhabdomyolysis, is a life-threatening complication from muscle trauma. Myoglobinuria is myo, meaning muscle. Myoglobin means it's a protein. and it's in the urine. So it's a muscle protein that escapes when there's trauma to the muscle. Rhabdomyolysis, rhabdo means skeletal, myo meaning muscle, and lysis meaning breakdown. So rhabdomyolysis is breakdown of skeletal muscle that causes myoglobin to escape into the bloodstream and into the urine, causing renal failure. So causes of myoglobinuria or rhabdomyolysis are ischemia due to pressure, trauma, fulminant malignant hyperthermia, viral infections, statin drugs, cocaine, anesthetics, heroin, strychnine poisoning, tetany, heat stroke, fractures, electroconvulsive therapy treatment, status epilepticus, and alcoholic tremors. Things that cause the patient either to lay in one position for a long time or cause violent contractions that might cause a problem. Symptoms are the urine becomes a dark reddish brown because myoglobin will color the urine. You'll have edema at the site that can cause tamponade locally, which will result in compartment syndrome with resultant ischemia of the muscle or nerve injury. The nerve injury will cause a contracture. So you'll have muscle ischemia, the nerve injury, contracture, elevated CK or creatinine kinase, which is an enzyme that's released from the muscle, a decrease in calcium, and death due to shock, cardiogenic and hypovolemic. They can also cause pulmonary edema or disseminated intravascular coagulopathy, which we'll be talking about in a couple of weeks. Renal failure occurs due to the protein damaging the glomerular basement membrane. Tachycardia is due to the stress response. Fever is due to the inflammatory response. Crush syndrome is the most severe form, and this was seen a lot in World War II, and particularly following overdoses where patients just kind of lay and wait for hours in one spot. Metabolic disorders of the bone alter the bone structure as a result of altered or inadequate biochemical reactions. An example is osteoporosis. With osteoporosis, you're going to have a reduced bone mass or density that is insufficient to support the skeletal structure. A cause might be aging, because you're going to have a decrease in estrogen, decreased weight-bearing activities, which doesn't promote calcium going into the bone, a low calcium intake, low vitamin C or D intake, increased caffeine, nicotine again, or alcohol intake can cause osteoporosis, and hormonal imbalances. Now, hormonal imbalances are either low estrogen or testosterone levels, or parathyroid problems, because that'll affect your calcium and your phosphorus. Cortisol, thyroid, and growth hormone have also been implicated as to possible causes. There are different types. Regional is where one segment of the appendicular skeleton has been affected. This is associated with disuse syndrome, immobilization, air suspension, or motor paralysis. Primary, iatrogenic. Iatrogenic osteoporosis is a temporary form in persons receiving large doses of heparin, glucocorticoids, lithium, methotrexate, anti-epileptic drugs, cyclophosphamide, or cyclosporin. And postmenopausal is because you don't have enough estrogen, and therefore it occurs in middle-aged and older women. Osteoporosis costs about $12.2 to $17.9 billion annually to treat. And they have different kinds of drugs that you can take either daily, weekly, or monthly to help with that. The pathophysiology of osteoporosis has to do with the remodeling cycle that's disrupted, leading to an imbalance. Now, remember that we lose 0.3 to 0.5% of bone normally every year. And if you're menopausal, you can lose up to 1% every year, normally. So in this disrupted remodeling cycle, calcium is removed from the bone. This can occur rapidly or slowly. It's usually a problem with the interaction between your osteoclasts and your osteoblasts. Remodeling of the bone can take up to 2 years. Remember, your osteoclasts break down and your osteoblasts build. And this can take up to 2 years to fix. Symptoms are bone pain, bone deformity, fractures, kyphosis, which is an abnormal curvature of the spine, and a decrease in height. Complications are fat emboli, pulmonary emboli, pneumonia, shock, hemorrhage. Risk factors are on page 1038. Fractures most often occur of the long bones, the distal radius, the ribs, the vertebrae, and the neck of the femur. That causes your fractured hip. Treatment could be Michelson nasal spray. Now, this is salmon calcitonin from the fish, you know. It is 30 times more effective than human calcitonin, and it allows the normal bone to form. And this is a picture of osteoporosis. On the left, you have normal bone. On the right, you have somebody who has osteoporosis. It's not any wonder it breaks. And here's osteoporosis risk factors. Access: alcohol, corticosteroids, calcium low, estrogen low, smoking, sedentary lifestyle. Access leads to osteoporosis. And again, after menopause, we have decreased estrogen, and it will cause kyphosis, which you can see is like that buffalo hump, or cervical lordosis, which is a little bit lower. And it's got the risk factors and the possibility of crushes that are there. This is part 1 of musculoskeletal. There will be 2 more parts. Talk to you shortly.